This video will show you how to add an APD ICU care period. We have our patient Sally Smith. By now you should be familiar with the admission tree. Patient details are found at the top right hand side of each screen. You can click between patient and the admission tree. The hospital admission details are found at the top here in green. Click here to edit the hospital admission. Click here to delete the hospital admission. Keep in mind when deleting parts of the record higher up, such as the hospital admission, you will delete content further down as well. The blue section is the ICU admission details. If the patient has a second ICU admission during the same hospital stay, click the plus symbol to add subsequent ICU admissions. Click here to edit the current ICU admission. Click here to delete the current ICU admission. Now we're going to move on to the care period, so click the plus symbol. There are 4 tabs across the top of the page: care period, blood gases, Glasgow coma score and scores. Data must be entered into the care period before moving on to the other screens. On this page, the highest and lowest values for each of the fields across the first 24 hours should be recorded. If results are not available for the first 24 hours, you can go back 1 hour. The first field asks, was the patient invasively ventilated? Click yes or no. Messages appear throughout to help you. You can use the keyboard to make selections for yes/no fields. Use the tab and the left and right arrow keys. As we add data, the system has built-in validations and warning messages. Here, a temperature of 50 is entered and a red message appears as this is much too high. When a temperature of 42 is entered, a warning message appears letting the user know that this is high but within acceptable limits. The high value must be higher or equal to the low value. To enter data, you can use the mouse to select the up and down arrow on the screen. Or you can use the keyboard by entering numbers or by using the up and down arrow keys. For blood pressure, we ask for the systolic high and low with corresponding diastolic pressure. The system will calculate the mean arterial pressure based on the systolic and diastolic, however you can override the mean arterial pressure. The diastolic value will not always be the high and low, as this corresponds to the high and low of the systolic pressure. Add the high value for respiratory rate. Select yes or no as to whether the patient was invasively ventilated at the time of the high respiratory rate. Again, a comment warning appears. Select yes only if the patient receives invasive ventilation at the time of high respiratory rate, not CPAP. Continue down the page, entering high and low values for each field. Enter urine output if known. If the patient is free voiding, tick yes to free voiding. This field is to help with data collection. If the patient is free voiding, a urine output will be unavailable. There is a warning for acute renal failure. To ensure your patient matches acute renal failure criteria. Ignore bloods not taken and biochemistry unavailable. These will be replaced in the next release of comment. Save the page. Select next tab, blood gases or ABGs. Click the plus new record to enter the blood gas. If ABG is unavailable, click No and save record. ABG unavailable now appears in the grid. You can enter as many ABGs as you have for the first 24 hours and comment will select the worst scoring ABG. Date and time are not mandatory, but remember the gas needs to be taken from the first 24 hours. Was the patient intubated at the time of ABG? There is no longer a field asking if the patient was invasively ventilated at the time of blood gas. Click Save, and the ABG now appears in the ABG grid. To delete an ABG, click the cross symbol and OK. Select the next tab, Glasgow Coma Score or GCS. Click the plus new record to add GCS. GCS is an important field that impacts on scoring, so it is important it is collected correctly. Record the lowest GCS during the first 24 hours of the ICU admission, provided the patient is free from sedation. If the patient was sedated, record the GCS prior to sedation. You can go back as early as required to find the GCS prior to sedation. The date and time defaults to the time of ICU admission. We've introduced a new field called GCS unavailable due to sedation. There are a few rules for this field. The patient must be sedated for the first 24 hours of ICU and 12 hours prior to ICU, and the GCS at the time of sedation cannot be identified. If the patient is not sedated and a GCS simply cannot be located, then they do not fit the criteria for this field. If your patient does fit the criteria, select Yes and click Save. The GCS unavailable now appears in the grid. Only one GCS can be recorded, so click here to edit the GCS. Click No as GCS is available, enter GCS details, click Save. The GCS now appears in the grid. Select the next tab, Scores. The Scores tab calculates score and risk of death for Apache 2, Apache 3 and ANSROD. No data is required to be entered here. Click back to admission to return to the admission tree. You can now see the care period on the admission tree. Click here to edit the care period and click here to delete the care period. Thank you for watching APD Care Period. This is the final video in the APD series.